Nothing much is ever gained from retrospective analysis, except for learning the mistakes of the past, which is why history is such a great teacher. But this week, a damning independent review into Australia's COVID-19 response and the economic and social havoc wreaked by government is why we must examine closely what must not happen during a next pandemic. And one of the greatest casualties of the havoc wreaked by poor and incompetent management by governments, both state and federal, is our children. Economic and social overreach found schools shouldn't have closed, and lockdowns and border closures were avoidable at the pandemic height. Furthermore, the review, jointly funded by the Paul Ramsay, John and Miriam Wiley and Andrew Forrest Minderoo Foundations, said the nation's most vulnerable communities were excluded from financial support and bore the brunt of the pandemic. Peter Shergold, Western Sydney University Chancellor, who led the review, said, while the fog of uncertainty clouded life and death decisions, that this does not mean we could not have done better. It was wrong to close entire school systems, particularly once new information indicated that schools were not high transmission environments. For children and parents, and in particular women, we failed to get the balance right between protecting health and imposing long-term costs on education, mental health, the economy, and workforce outcomes, the review says. Rules were too often formulated and enforced in ways that lack fairness and compassion. Such overreach undermined public trust and confidence in the institutions that are vital to effective crisis response. It also found lockdowns and border closures, which triggered significant social and economic costs, should have been a last resort, but they weren't. Instead, for many of Australia's premiers, they were the first resort. It was decisions made by unqualified public servants with no experience in pandemic management. Decisions government knowingly assigned to men and women without expertise in an area that they had no relevance in. So here are the mistakes that the report highlighted that were made. Economic supports should have been provided fairly and equitably. Lockdowns and border closures should have been used less. Schools should have stayed open. Older Australians should have been better protected. And its recommendations. Going forward, we need to strengthen crisis preparation, planning and testing, establish an expert body and trusted voice on public health. We need to improve government decision-making through broader advice and greater transparency. We need to enhance public service collaboration, capability and communication. We need to modernise how governments use data, build a culture of real-time evaluation and learning in the public sector. It seems so obvious now. And some of the key facts in the report, that COVID death rate for people born overseas was 2.5 times as high as for those born in Australia. And Australians in the bottom 20% by socioeconomic status were 3 times as likely to die of COVID-19 than those in the top 20%. And in 2021, vaccination rates for people with disability were 10 percentage points lower than for other Australians. And in 2020, more than 75% of deaths occurred in aged care facilities. And the rate of severe illness was 40% higher for Indigenous Australians during the Omicron wave. Women were more than 30% more likely to exit the workforce than men in the first months of the pandemic. And students in the bottom 20% by socioeconomic status were more than 40 times more likely not to have a computer for remote schooling than students in the top 20%. Young adults under 25 were twice as likely to experience mental ill health than adults 25 and over. Too many of Australia's lockdowns and border closures were the result of policy failures in quarantine, contact tracing, testing, disease surveillance, and effectively communicating the need for preventative measures like mask wearing and social distancing. Politics has also played a major counterproductive role. Localised outbreaks were always inevitable, but statewide and nationwide outbreaks weren't. According to the report, the federal government net debt has risen from 19% of GDP in 2019 to 28% of GDP in 2022. It will take us more than 20 years to return to Australia's pre-COVID debt to GDP level if the economy returns to its long-run GDP growth rate, the review said. Total debt across the states and territories is almost four times as high as what it was in 2019. Now, restoring fiscal policy buffers is essential to provide sufficient firepower to respond to the next crisis, because there will be a next crisis. Governments will need to decide who should bear the cost of budget repair and how much of it will fall on young people, because COVID policies were designed and implemented without proper regard for the inequalities that already exist in our society and the vulnerabilities of particular communities. COVID will always be a story of trauma, isolation, and terrifying uncertainty. It will also be a story of being locked in overcrowded housing, job loss, and missing out on government supports, the review said. It will be a story of more domestic violence, increased alcohol abuse, deteriorating mental and physical health, and it will be a story of loss and the brutal realisation of not being able to say final goodbyes to our loved ones. In future crises, we need to place vulnerable Australians at the centre of our planning. So we've got to ask, what have we learned? Well, I believe Australians have learned that its public servants are not only incompetent, but ill-equipped to lead in a crisis of national significance.